Hello everyone, this is Dr. Miller again, and today I'm going to talk to you about what actually causes high cholesterol, and is the high cholesterol what's causing your heart attacks and heart disease? We're going to talk about just some things that you've been taught, that you see on TV, that you hear about in the news, and then the reality of what cholesterol is and what it does to your body. And let me just start off by saying that cholesterol is a vital nutrient in our body. And so, we typically go and when we get blood results back from our physicians, we're really concerned about our what we call the lipid panel, okay? And so the lipid panel being your total cholesterol, your HDL, your LDL, and your triglyceride levels. And let me just say that if that is the only markers that your doctors are running on you, they're really doing you guys a disservice, because in order to determine your risk for a heart attack or heart disease, or how these cholesterols are playing a role in your health, you need to dive deeper and test different markers than just those four markers that I mentioned. And so what I want to talk to you about today is not only what cholesterol is, how it affects your body, but things that you can do, some dietary things and some exercise that you can do in order to improve your cholesterol numbers. And so let's just start off by talking about what overall cholesterol is, where it's produced, and what it does for us. Now, the reason why I say cholesterol is a vital nutrient in our body is because, number one, by weight, cholesterol is the most abundant nutrient in our brain. It makes up all of our cell walls of our brain cells. Also, we need cholesterol to synthesize or to make any kind of hormones. All hormones in our body, we need cholesterol in order to synthesize or to produce those hormones. And so you can see that if we start to put people on statin drugs, we start to reduce the levels of cholesterol in your body, how it can negatively affect you, because it's going to affect brain function, it's going to affect your hormone levels. Now, a lot of times when it comes to high cholesterol, when you go to your doctor telling you have high cholesterol, and they start to talk to you about dietary recommendations, some dietary things that you can do in order to reduce your cholesterol levels. In reality, cholesterol is produced by our body. So our bodies produce cholesterol in the liver, and then we take it out to the body in order to do its jobs. And so a lot of you guys watching this video, you're dealing with heart disease, you're dealing with high blood sugar or diabetes. And you have seen that, you had normal cholesterol levels for years, and then once you developed disease processes like type 2 diabetes or heart disease, those cholesterol numbers start to climb. And so let's just kind of break down those cholesterol numbers or those markers and talk a little bit about what those are. Cholesterol, total cholesterol, and then quote unquote what they call the good cholesterol and the bad cholesterol, right? Your LDLs and your HDLs. Now, I just want to clarify that LDLs and HDLs, they're really not even cholesterols, right? Low density lipoprotein and high density lipoprotein. So those are proteins, and the protein is like a taxi cab. So the LDL, the low density lipoproteins, they carry cholesterol from the liver out to the body in order to do its job. The HDL is the protein or the taxi cab that takes the cholesterol from your body back to the liver for degradation to get rid of the cholesterol, okay? And so a lot of times we see an increase in LDLs when you have inflammatory disease processes like type 2 diabetes. And the reason why those LDLs, or one of the reasons why those LDLs are increasing, is because when you have these inflammatory processes occurring, especially at the vascular level, what your body wants to do is it wants to send that cholesterol to heal or protect the inside lining of the blood vessel. Okay, now we have three layers of smooth muscles that make up the inside lining of the blood vessels. And so when I said that we need to dive a little bit deeper when it comes to investigating the different cholesterol markers, for example, LDLs, low density lipoproteins, when you test just your overall LDL, a lot of times with patients, that are suffering with arteries that are being occluded and heart disease, your overall LDL count is either going to be normal or just slightly elevated. But again, just by looking at that marker, it doesn't tell us whether you're at high risk, moderate risk, or low risk for a heart attack, because we need to see what size those LDL markers are. See, the research says that people that have heart attacks, half of those people have high cholesterol and half of those people have normal cholesterol. And so again, what is causing that heart disease? What causes those arteries to get occluded and cause someone to have a heart attack or stroke? And in the reality, the LDLs, there's both the larger size particles and smaller size particles. So I like to use the analogy of a golf ball size particle and a tennis ball size particle. And see, the inside lining of the blood vessels, that first lining of that smooth muscle, it's kind of a filter, right? And it's kind of like a tennis net. And so these large particles, these large fluffy LDL particles, they travel through the bloodstream and are fairly benign to how they affect the arterial lining. But the small particles, these are the particles that, the LDL particles that's been oxidized. And I'm going to talk to you about why the oxidation process happens and things that we can do dietarily to slow that oxidation. Okay, we can't really stop the body from oxidizing, but we can do a lot of things to slow that process. And so once these large LDL particles become oxidized, they become a lot smaller. And like I said, these are the golf ball sized particles. And so when they travel through the bloodstream, that tennis net is not able to filter out the golf ball sized particles. Therefore, you continue to plaque those arteries. And this is where eventually the artery will be occluded. And then you have a heart attack or a stroke, right? Well, here at the Wellness Way with our patients, we dive very, very deep into the physiology. And so we have very specific specialized testing that we do through blood that will look and see how many of the small particles and how many of the big particles versus how much of the overall. See, I had a patient in this morning, the wife of a diabetic that I'm treating, and she just wanted to make sure she was healthy. You know, her doctor said she's doing fine. She's only on one blood pressure medication, and so she thinks she's doing pretty good. So we run this blood panel on her, and all she's had ran on her in the past is overall cholesterol, HDLs, and LDLs, and they've all been normal. Her LDLs were 101, and as you know, we should want those under 100. And so her doctor said, man, you're doing great. So we run our blood panel on her, and the small particles, a number that we want to see under 20, these small LDL particles were 97. And so I knew that even though her overall LDL count was normal, she has a tremendous amount of plaquing going on inside her arteries. And again, if she doesn't change something, it's just a matter of time before the artery gets occluded and she has a heart attack. And so again, we need to look deeper onto what exactly is going on when it comes to the cholesterol levels. But again, cholesterol is vital, and so very rarely will I even work with somebody that's on a statin drug because of the effects that those statin drugs have on reducing cholesterol levels, and then the effects of those low cholesterol levels inside the body, and the negative effect that has on our physiology is tremendous. And so we really need to, instead of just trying to drive down our overall cholesterol levels, we need to ask the question of why is our cholesterol increasing? Now, one of the major causes, the main cause is hormone imbalances. Now, for many different reasons, stress, inflammation, for different reasons, people get hormone imbalances, and usually vital hormones start to decrease in the body. And so your body's response is the liver is going to start to produce more cholesterol. Why? Well, because we're deficient on hormones and we need cholesterol to make hormones, and so your body's response is it's going to produce more and more cholesterol in order for your body to synthesize more hormones. And so again, what is the hormone imbalances due to? Inflammation is a big part of that. Stress is a big part of that. Different procedures that women have done, like hysterectomies, and some of the birth control medications, and the hormone, the medications that bully hormones, right? So there's just a lot of issues that are causing these low hormones. And again, we need to test. Our motto in this office is we don't guess, we test. And so we need to test you in depth to find out what those hormone imbalances are being caused by. So let's talk a little bit about some dietary recommendations, some dietary things that we can do, because there's a lot of misnomers about healthy fats or fats in general, right? Oils and fats, they get a bad rap. And the reality is it is essential that we're consuming not only a lot of fat on a daily basis, but the right kind of fat. Ever since our country went to a low-fat diet, we've gotten more and more obese. And the reality is any kind of low-fat product, they replace the fat with sugar. And so not only is sugar detrimental to your body and causing a lot of inflammatory processes to occur, but the healthy fat is just essential. That saturated fat that we're all told we need to stay away from is just essential in order for you to have not only healthy cholesterol levels, but help to slow that oxidation process. Okay, so what oils should we be using when it comes to cooking and things like that? And so let's just talk about, first off, the oils that we need to be staying away from, right? So the rancid fats like vegetable oil, canola oil, corn oil, the partially hydrogenated oils, the soybean oil, safflower oil, cottonseed oil, these oils are rancid fats. So when you consume these oils, your body cannot break them down, and it is going to speed up the oxidation process tremendously. And again, remember, we talked about that oxidation is what causes that nice, big, fluffy molecule that's benign and does not affect you negatively to oxidize down to a smaller molecule that's able to penetrate that first lining of the blood vessel wall, therefore causing the plaquing that leads to a heart attack. And so absolutely want to stay away from those oils. A lot of those oils is what they use to cook chips and cookies and things that are processed, things that are in bags and boxes. Now, on the opposite side of the coin, you can be using things like olive oil, but using them wrong, and again, that's going to cause a very similar effect on the body. And so, if you're going to be cooking with oils, right? If you're going to be frying anything in the frying pan, avocado oil and coconut oil are the only two oils that you should be using because of how stable they are at high temperatures. Now, olive oil, on the other hand, is a fantastic oil for you to consume, but when it's heated, it's got a very low threshold when it comes to heat. So when it's heated, it will oxidize and it will turn into a rancid fat. And so olive oils is what we want to be using to make salad dressings and things like that. Drizzle it on your meat after you cook it. But things like coconut oil, avocado oil, grapeseed oil, and even ghee, right? Ghee is the when you melt down butter, right? You've seen butter melt down and it kind of separates. Well, that top healthy butter is what's called ghee. It's the purified butter. Now again, guys, we need to absolutely make sure that you're finding a practitioner that is testing your food sensitivities, because if you've got a sensitivity to avocado, or if you've got a sensitivity to coconut, or if you've got a sensitivity to cow's milk, right? We need to make sure that we're following those sensitivities and consuming the correct fats for our body. But generally speaking, again, we want to make sure we're getting in a lot of those good, healthy, saturated fats coming from coconut oil, grapeseed oil, avocado oil, and then animal fats. Animal fats is just absolutely very, very good for your body's physiology and how we function. So again, I hope you guys got some good information from this. There's a lot of people that need to hear this information. So if you found this information helpful, I do ask that you like this video, share it around, and I look forward to connecting with you next time.